All right, so it's Natanya. Remember, I'm your guide in really demystifying the multitude of approaches that are out there and helping you live your life with vitality. So there's this new trend that I'm seeing, which is getting Botox in the upper trapezius muscle. And people might get this for several reasons. I'm going to go over that in a little bit. But here's my thoughts. Everybody knows I'm a certified ROLFER, a massage therapist, I'm a certified personal trainer. I have a couple different, actually multitude of backgrounds that I come from. And I'm all about taking a holistic approach and avoiding, medications, any type of like injections, things like that, like try to heal your body from within. Botox, when you inject it into the upper trapezius muscle, produces a temporary paralysis of the muscle. And basically this is because Botox blocks the release of something known as acetylcholine. This is a neurotransmitter that normally triggers muscle contractions. So as a result, the muscle that's injected with the Botox becomes weakened or relaxed, and this leads to a reduction in muscle activity and tension, which can be such relief. So it can have several effects. Number one, reduce muscle spasms. So it can help alleviate that muscle tension or spasms that come up when you don't want them to. And trust me, I know what that feels like. Have your traps constantly trying to be worn as earrings. So it can really help with common conditions such as cervical dystonia or tension headaches. And I'm going to go over a couple more also. But I mean, the relief can be great when it comes to using these Botox injections in the upper trap. It can provide relief from those of you that have chronic neck pain and shoulder pain. And this is particularly relevant for individuals experiencing myofascial pain syndrome or tension type headaches. So it can also improve range of motion, because when you relax a muscle, it's not going to be constantly holding on to that joint, not allowing it to move. So if the upper trap's tight, it can limit your neck mobility, your shoulder mobility based on where it originates and inserts. It also comes down and has an insertion all the way in the lower thoracic region. I mean, so you can imagine tension and tightness here. So we all know Botox as the cosmetic effect. It helps reduce wrinkles and fine lines. And if this is what you want to do, go for it. But when you inject it into the upper trapezius muscle, it can actually help soften the appearance of neck and shoulders and get these really great horizontal lines. It's important to note Botox injections typically last for several months and then gradually dissipate or wear off. Now, here's the deal. There can be a lot of causes for upper trapezius muscle tightness, and you really want to get to the root cause. One of the reasons can be various neurological signs or conditions. So here's an example. You can have a pinched nerve, and this is a condition when a nerve in the neck becomes compressed or irritated. Nerves don't like to be compressed. This can often be due to a herniated disc or narrowing of the openings in the spine, known as stenosis. This can cause radiating pain or tingling or numbness from the neck to the upper trapezius muscle, leading to tightness or spasms. All right, here's another one. Headaches, or specifically cervicogenic headaches. This type of headache originates from the neck region, and it's often due to tension or structural abnormalities in the cervical spine. So increased muscle tension in the upper trapezius muscle is common in people with these type of headaches. Another one. Brachial plexus injury. So the brachial plexus is a network of nerves that control movement and sensation in the shoulder, arm, and hand. And if this bundle of nerves is damaged, such as from trauma or compression, it can lead to muscle weakness or tightness in the upper trapezius and also surrounding areas. And that could not be fun. Another one. It's known as thoracic outlet, but I think we should call it thoracic inlet because basically it's the inlet up here. It involves compression or irritation of the nerves and blood vessels in the thoracic, what we like to call outlet, I'm going to call inlet, which is the narrow space between the collarbone and the first rib. So this can cause muscle tightness, pain, and weakness in the upper trapezius muscle, along with other symptoms like numbness, tingling in the arm, whole bunch of not fun stuff. Last but not least, nerve entrapment. And this is kind of a spin-off on the others. So it can be entrapment of specific nerves, such as spinal accessory nerve, and it can lead to muscle dysfunction and then tightness in these upper trapezius muscles. Now, it's important to note that while the upper trapezius muscle tightness can be influenced by these neurological factors, it can also be associated with factors such as poor posture, like the way I'm sitting right now. Overuse, stress, or muscle imbalances. Therefore, a thorough evaluation by a healthcare professional is absolutely necessary to determine the underlying cause. However, I will never say don't do something if it looks like something that you want to do. I'm just going to give you both sides, okay? I'm going to tell you what it does, what it doesn't do, and if you do decide to do it, what the effects, positive and negative, might be. And if you want to go through with it, fine, let's partner with a great practitioner who knows what they're doing, and then also work with a trainer or a healthcare professional to go along with those Botox injections. So what I mean is, Botox basically shuts down the muscle or calms it down. So if you have a really tight, overactive muscle, it kind of acts like a hyperactive kid, always acting up, always trying to get a word in edgewise. I can think of somebody. Anyway, I was doing that for my brother. Anyway, so when you have a hyperactive kid, the other kids can't get their word in or can't participate, right? So that's kind of like your muscles. When you have a hyperactive, tense muscle, it's not going to allow the surrounding muscles to activate. It's something known as like a synergistic dominance, or when one muscle contracts, the opposite muscle needs to relax. So this can happen, and it can be a faulty recruitment pattern. For example, if your pec is really tight, it can be a hyperactive muscle not allowing the muscles in the back to activate. So in this case, let's talk about the upper trap. The upper trap typically can become tight from postural issues. So if you're sitting at a desk all day and the front of your body gets really tight, kind of like I'm sitting right now, these muscles are going to become really tight, short, and they're going to adapt to that position. But then you need to hold your head up, right? I can't walk around with my head down. So what muscle is going to bring my head up? My upper traps. They're the best bad boys to hold my head up, but they're really not meant to do it like this. So they're going to become really uncomfortable, and a lot of tension is going to be built in there. So what we do in the personal training world is we try to relax those upper traps through soft tissue mobilization, stretching, cupping. ROLFing is great for that, because we try to relax the muscle, get the mobility back in that joint, and then we're able to strengthen the muscles that are really supposed to be doing the job. So it works really well together. But Botox kind of like takes the back route, or the Batman route, or the Batcave route. And it's gonna calm down those muscles, but it's important that you work with a really good practitioner. What I mean by this is somebody that knows the anatomy of the face, of your neck, of your shoulder. I love working with Irina from El Eve Spa in Woodland Hills. She is a master at this and knows her anatomy. So if I have a client that goes in, and let's say they're going to decide to do this, and I let them decide. I'm not going to tell you what to do, but if this is what you want to do, here we go. Let's do it. So you're going to go into Irina, you're going to get your upper trap relaxed, then you're going to come back to me, your ROLFER or personal trainer, and we're going to start activating those muscles that need to be activated to make sure when that upper trap comes back online, it's not going to be in control anymore, because we've strengthened those other muscles. So have a program, look at it from many different angles, and if you're gonna do something like this, make sure you're with a team that will support you. You don't want somebody to tell you, no, never do this, or yes, do this. You want somebody, if this is what your body is telling you to do, okay, let's see how we can do it together.